Hello, everyone, and welcome to another CB Clips. This week's CB Clips was a case of an umbilical infection in a teenage boy. And you can see the findings are clearly shown on the physical exam. And on the ultrasound, you really see a small abscess under the umbilicus and a patent structure down the midline of the abdomen. And everybody made the diagnosis correctly that this is a urachal infection. And what are the clinical principles? Well, I think there are three important clinical principles. First, that an umbilical or a periumbilical infection is the most common presentation of a patent urachus. Second, that these respond very well to antibiotics. Drainage is typically not needed. You can start with IV antibiotics if required, but really most of them respond even to oral antibiotics. And third is that you should delay surgical resection until the infection has resolved. I want to show you some pictures of the resection on this patient. I use a laparoscopic technique with lateral placement of 5mm trocars. Here you can see still significant infection at the umbilical end of the urachus. We dissect that and then we take it down towards the bladder, dissecting the urachus along the way. You can see the extent of the caudal dissection. And as we get to the junction of the bladder, this is where I ligate the urachus. I don't really make a point of taking a bladder cuff because I don't believe there's much evidence for that. And once we ligate it, we remove the urachus in its entirety. Now, there was some commentary on whether that is actually needed after an infection. And I would say yes. Why do I say yes? Well, look at the histology on this patient. Here we see at the umbilical end, there's severe inflammation, but still patency of the urothelium. And on the bladder end, as we're really getting close to the bladder muscle, you see a lot of thick, smooth muscle, but again, patency of the urothelium. If you have patent urothelium, I think that sets up the patient for another infection. This is not an epithelium that has burnt out. So I do believe that surgical resection is indicated after an infection. Thank you, and until another CB Clips.